For 12 years, we've been hearing of healthcare costs reaching a level of crisis. In 2010, U.S. healthcare was born with the reduction and elimination of coverage for persons receiving Medicaid, along with the onset of the closure of HUD to new applicants. U.S. healthcare has been determined as broken, being unavailable to all Americans with a shrinking subscriber base. With enormous funding by the federal government in the form of state subsidies and tax credits, the plan has become costly and ineffective. The healthcare cost crisis has not yet been solved. With Medicaid benefits at below acceptable levels and relatively few Americans opting to subscribe to U.S. healthcare, the system is worse now than when the effort started. People, here's a plan. Extraordinary markups exist on pharmaceuticals from wholesale to retail pricing. That markup allows retailers, and in some cases pharmaceutical companies, to profit enormously, taking advantage of consumers. We can start solving the healthcare cost problem there, by virtue of the Federal Trade Commission Act of 1914, not socialism, and limit retail markups on pharmaceuticals. President Trump eliminated unfair price differentials, where one entity or country would be charged one wholesale or retail price and another a greater or lesser value. The president has stated he's just begun to limit the profitability of pharmaceutical companies, though without harming the process of research and development. We cannot give up a fundamental construct to the industry that has allowed for so many hundreds of millions of people to live longer, as well as better and more productive lives. This country is by far a leader in pharmaceutical and biotechnological research and development. To inhibit our role as an innovator in the industry would take from the world the benefits found therein. Limiting the profitability on newly introduced pharmaceuticals would be counterproductive. The truth is that we don't have to. While limiting the markup from wholesale to retail may hurt retailers like Walmart or Walgreens, consumers will have more money to spend on other goods by virtue of lower pricing and lower health insurance costs. Funds will flow to the purchase of other goods and services, finding their way to businesses and people in virtually every sector of our society. The savings to Medicare may even exceed $300 billion. Those savings could be utilized to partially fund HUD. That was a tremendous success and should be reopened. And from lower prescription costs, as well as health insurance premiums, expect a burst to the economy that will also add to employment, GDP, and tax receipts. Understand that existing prescriptions have been around for years. Another 55 will lose their patent protection between now and 2022. We should foster the emergence of new generic drug companies who must fight inherent barriers to entry, such as distribution, name recognition, and market acceptance. We can also limit the retail pricing on long-standing drugs that are well past their patent protection, making them available to world markets. We can assist U.S. pharmaceutical and biomedical companies in finding world markets, arranging export and distribution abroad. The world is as yet an untapped market for U.S. pharmaceutical companies, where billions of people would benefit. Finally, let's restore Medicare to its pre-2010 state so that it will include insulin treatments, MRI testing, physical therapy, chiropractic care, and include coverage of eyeglasses, hearing aids, and dentures. Finally, let's restore Medicare to its pre-2010 state so that it will include insulin treatments, MRI testing, physical therapy, chiropractic care, and include coverage of eyeglasses, hearing aids, and dentures. And to afford making Medicare a sustainable and quality healthcare choice, let's close U.S. healthcare. U.S. healthcare has a minimal subscriber base, perhaps as few as 8 million people or less. U.S. healthcare has been determined as broken by both Republicans and Democrats, including Senator Sanders. If the federal government closes U.S. healthcare, the savings are enormous and include the end of state subsidies as well as tax credits to subscribers. Those subsidies and tax credits have, in some cases, squeezed out private insurers. The closure would also free up over $1 trillion held in escrow for the purpose of maintaining solvency of the program. That's savings as much as $500 billion, along with approximately $300 billion from limiting retail markups on prescriptions can fund HUD. Further cost savings to Medicare could be as much as another $500 billion. Factoring in the cost of restoring Medicare with certain inclusions such as eyeglasses, hearing aids, and dentures, the net cost is likely not out of reach. And that $1 trillion in escrow could be used to pay off some debt. Remember HUD? Property owners who face foreclosure could circumvent losing their home if they agreed to add their home to the HUD pool. With $7,000 made available by HUD to such homeowners, improvements could be made, including handicap access and upgrading. Under HUD, rent and fuel costs are subsidized. Landlords are assured their rental income. Tenants only have to pay a small portion of their rent. Families, individuals, and disabled persons find homes, and communities prosper. The program worked. We need HUD back now. The changes described above would create jobs. As money finds its way into the economy by way of lowering prescription costs or subsidized rental payments, more money is in the hands of consumers, who immediately benefit. Those savings will filter through the economy in the form of the purchase of goods and services. Businesses and manufacturers will respond by adding jobs. The above changes will improve the quality of life for all Americans, including children. The above changes will diminish poverty, unemployment, and as a result, homelessness. Also, other systemic problems that have arisen from poverty and unemployment, such as child abuse, domestic violence, illicit drug trafficking, and so on. We shouldn't change this country. We should look to the programs that have shown proven success. We should undo the mistakes of the past. We should curtail pharmaceutical costs substantially at the retail and wholesale level, close U.S. health care, reinstate and enhance Medicare, and reopen HUD. However, that's not all. We also need to extend the tax credit made available for the purchase of electric and hybrid vehicles that is set to expire at the end of the year. If elected, I will also fight to extend this tax credit. As a Republican, I believe in free market enterprise, limited government, and the funding of entitlements to help raise the poor out of poverty. As a Republican, I believe in referencing our own democracy, our own Constitution, and the philosophy found therein for the answers. Republicans do not waver in their politics. The Republican platform stands for this country, the country that we all know and love. That's what I am. As I well understand the philosophy behind this democracy, economics, and the work that needs to be done, this election 2020, I ask you for your vote. Together we'll keep our freedom, our independence. We'll not shift power into the hands of the government, or taxes, or property, or wealth. Together we'll solve the problems at hand, and we'll reference the successes of the past.